Each day, young children who are deaf or hard of hearing are being served in early childhood education and healthcare settings. The question is, how will we know who they are? Hearing loss is an invisible condition. So how can we reliably identify which children have normal hearing and which may not? The short answer to that question is that professionals can learn to conduct evidence-based hearing screening. Formal hearing screening is essential because as close as we might look, we can't see a hearing loss. Permanent hearing loss is the most common birth defect in the United States, and over 90% of babies with this condition are born to hearing parents. Most newborns are now screened for hearing loss, but not every baby gets this screening. Babies not passing the screening require further evaluation, but some are lost to follow-up and don't receive it. These are two of the reasons why periodic screening throughout early childhood is needed. Even when babies pass the newborn hearing screening, it's important to continue to screen throughout early childhood because hearing loss can occur at any time in a child's life as a result of illness, physical trauma, or environmental or genetic factors. For example, by 4 years of age, 10% of late-onset permanent hearing loss is caused by congenital cytomegalovirus. Research suggests that the incidence of permanent hearing loss doubles between birth and school age, from about 3 children in 1,000 at birth to about 6 in 1,000 by the time children enter school. That's why screening during this vulnerable period in a child's life is so important. Language development is at the heart of cognitive and social-emotional development and school readiness. Hearing health is at the heart of typical language development. Young children who pass the screening are ready to take full advantage of rich language learning environments, while those who do not pass can receive audiological assessment and intervention services. Screening and appropriate follow-up can dramatically improve options and outcomes for children who are deaf or hard of hearing. While newborn hearing screening results are valid at the time of the screening, they do not necessarily reflect a child's hearing status in the following years. And although EPSDT specifies that healthcare providers are to incorporate hearing screenings into well-child visits at 4 years of age, evidence-based screening is not uniformly conducted. Routine examination of ears by healthcare providers should not be mistaken as hearing screenings. Unless records include documentations of ear-specific results and the method used, we should not assume a valid and reliable hearing screening was completed. So, how will we identify which children may be deaf or hard of hearing? Through the use of an evidence-based hearing screening method and follow-up audiological assessment.